Okay, so here we are. It's 30 days today after I had my surgery. I did the right shoulder. I did the full tear rotator cuff. I had a torn bicep. And from where I broke my collarbone, I had a bone spur. So they took out the bone spur and stitched up the bicep muscle and the rotator cuff. While they were in there, they did some arthritis clean out. They cleaned up some arthritis in there. And I also had the right carpal tunnel. You can see right at the bottom of the palm, there's a single incision where they did the carpal tunnel clean out. I think they actually cut the ligament, actually, is what they do during that process. I'm not sure about that. So it's 30 days in, and let me tell you my little 30-day journey. Most people get a nerve block right in their nerve, so they don't feel the pain when they do that shoulder surgery. And that takes care of the first couple days of real pain. And then they give you some painkillers, for a few days after that. Well, guess what? I'm a pretty big guy. They couldn't find the nerve. They couldn't do the nerve block. So when I woke up, it literally felt like they were still doing the surgery. So I had a tough time the first couple of days with pain. And we used some narcotics. I'm totally against narcotics, but I had to use Percocet. And I'll tell you, I used the Percocet for 2 weeks. And I've been able to not use the Percocet after 2 weeks. This is 4 weeks in. I have full range of motion because I've been doing all my exercises. It still hurts. As far as the hand goes, it's sore, but I don't get any of the carpal tunnel syndrome symptoms. It doesn't go to sleep. It doesn't go numb on me. Grip strength, I'm a little concerned about that 4 weeks in. But everything's coming along pretty good. And the reason I'm doing this video is because I'm doing the other hand today. So 30 days later, I'm doing the second hand. Probably if you didn't have the same issues I did, I'd probably wait a little longer between surgeries. But there's 4 days left in the month or the year. I don't want to pay that $6,000 deductible again that Obamacare has given us. So I'm going to finish it up before the year is over so I can save myself $6,000 in deductible. So overall, I definitely would say that my pain is less than it was before the surgery. It's different kind of pain, but I don't feel my shoulder bone popping around inside the socket because, the rotator cuff was tore. I don't feel that pain anymore. I still can't lift anything of any significance. Just as a comparison, a gallon of water or a gallon of milk, I've got to support it from the bottom with the other hand. Pre-surgery, I had a lot of concerns, wiping your butt, things like that. I thought of all kinds of things, like there's a bidet attachment you can get at Home Depot for about $30 and put on your toilet and maybe clean your bum that way. I was really worried about it. So I did a lot of stretching exercises to make sure that I could take care of all those issues with my left hand and right hand both. But really, it turned out it wasn't an issue at all. After the third day, personal hygiene is back at its premium. Loofah on a stick is pretty cool when you're having this kind of surgery because there is a lot of range motion that you have trouble with the first couple weeks. But do your physical therapy. I really quit going to the guy after a week because I wasn't sure my insurance was going to cover everything. So he gave me the lowdown on what to do, and YouTube is pretty helpful in physical therapy. You can get a lot of videos there. So do your physical therapy. You do your circles, 20 circles, with your arm down to the left, and then 20 circles to the right. And then on the rotator cuff, you gotta work all your range of motions, and you just keep doing it. I'm gonna start with a pulley this week, pulling some weight. so I can hopefully strengthen that now that it's healed up. There were literally just 6 small puncture wounds with stitches where they went in and did all that surgery with some kind of a scope and some surgical tools. I think it's robotic when they do the shoulder surgery. The hand surgery, just 1 small incision right there. I'm diabetic, so I'm a little slow healer, and I use my hands a lot, so that one's been a little slower healing than the rest. The rest are completely healed. I still have a scab on the hand, but overall we're doing really well. And in about 30-45 minutes, they're going to do my other hand. So I would say go ahead and do it. This hand still is constantly giving me a problem. It hurts. It goes numb on half the hand at a time. And it's extremely painful to drive and things like that. So I'm no longer having those problems with this hand. It's really sore from the surgery. And the bruises have gone away. You can't see the bruising anymore, but I can still feel, the pain when I work my hand. So, but that's gonna go away. I'm not worried about that. It's better every day. I'm off the pain medicine for that side of my body. So here we go. I'm going into surgery in just a few minutes, and wish me luck. I'll report back and let you know how this is doing. So, rotator cuff, definitely do it. I feel like I'm going to get stronger on my shoulder. I'll be able to do things with it again. Hopefully I'll be able to get into a workout soon. And the hand, definitely an improvement at 30 days. So talk to your doctor. Make sure he talks to you. I mean, my doctor talked to me and told me exactly what he was going to be doing, and I felt really comfortable with him. So, all right, here we go. Headed for the next surgery. You guys have a great day. Thanks for watching the videos. As always, if you can like the video, that really helps me out. And, of course, the way we support the channel is I'll put some physical therapy items in the description if you want to purchase them through that link. That we get a small commission for that. So thanks for watching the video, and you have a great day. Goodbye.